Hello, everyone. My name is Kyle Sebastian, and I am the JED Campus Learning Community Coordinator at the JED Foundation. The JED Foundation is a leading nonprofit that exists to protect emotional health and prevent suicide for our nation's teens and young adults. And we have partnered with over 260 colleges and universities through our signature program, JED Campus. JED Campus is designed to guide schools through a collaborative process of comprehensive systems, program, and policy development with customized support to build upon existing student mental health, substance use, and suicide prevention efforts. Today, JED Campus would like to welcome 3 student affairs professionals who have executed a pilot survey of the National Faculty and Staff Health Assessment by the American College Health Association. As part of JED's campus-wide comprehensive approach, we're super excited to support the wellness of your institution's faculty and staff in the same way you would for your students. Today, I am joined by Nikki Brower, Director of Health Promotion and Wellness at Illinois State University, Dr. Faith DiNardo, Director of Wellness at Bowling Green State University, and Holly Lovin, Associate Director of Wellness and Bronco Fit at Boise State University. Before I pass the presentation off to them, I'd like to share a couple of housekeeping notes for today's webinar. If you need closed captioning services at any point during the presentation, please use the link that was provided in the GoToWebinar chat when you were welcomed to the webinar. Similarly, if at any point during today's presentation you have a question for Nikki, Faith, or Holly, please type into the question box on the GoToWebinar dashboard at any point during the presentation, and we will answer it during our Q&A at the end. And finally, for those unable to join this call live, this webinar will be recorded for future access via the JED Foundation's GoToWebinar registration link. And with that, I would love to kick it off to Faith, who is going to go ahead and open today's presentation.
Okay, great. Thanks, Kyle. Hello, everyone. I am Faith DiNardo, the Director of Wellness at Bowling Green State University, and we are so pleased to be able to share this information with you all today about our National Faculty and Staff Health Assessment. So we thought we'd start off the presentation just providing folks with a history of where we've been with the health assessment. The Faculty and Staff Health and Wellness Coalition of the American College Health Association has actually been thinking about this assessment for several years now. We started in 2012 surveying institutions to see if they would have an interest in something like this, really a survey similar to the National College Health Assessment for students, but focusing on faculty and staff, really to provide an assessment for the entire campus, because we know it's great to know what's going on with our students, but we want to look at the health and wellness of our campus as a whole. And so one of the things the coalition thought was having a National Faculty Staff Health Assessment would provide that comprehensive look at campus health and wellness. And so when we surveyed institutions, the majority of institutions indicated that they would indeed like something such as the National Faculty Staff Health Assessment to begin to look at the data of their health and wellness associated with faculty and staff. So really the rationale considered to be the equivalent for surveying the behavioral health of faculty, staff, and graduate students. It's really marks the first benchmark survey of its kind. That's one of the gaps that we found as a coalition, is there really isn't anything out there that we can benchmark with other institutions, similar to how we do with the National College Health Assessment for students. And we use the objectives for staff and faculty in Healthy Campus 2020 as kind of a jumping off point and something to add to with this particular assessment. So one of the things that we wanted to do was gain approval from the American College Health Assessment, of the American College Health Association board approval, which we received in 2014. The board accepted our proposal, and that's when we began really working as a subcommittee of the coalition to take a look at crafting the survey, and there were many dedicated folks from across the country who put together this survey tool. And we utilized a variety of different data points. So obviously we took a look at the ACHA, NCHA2, NHANES, the CDC BRFSS. We took a look at some specific institutions and what they were doing around this area with faculty and staff health and wellness. So Illinois State, University of South Carolina. We took a look at the quality of workplace module, the Stanford Health Assessment. So again, a lot of different tools to kind of bring this together, to put together the National College or the National Faculty and Staff Health Assessment. So again, it's several years in the making, and we're so pleased to be able to share this information with you today. One thing I did want to mention too is, as some of you who are familiar with the National College Health Assessment know that a pilot is going on for the NCHA 3, and so we've been working very closely with the American College Health Association for questions that are similar on our faculty and staff survey to make sure that we are also making those revisions as that has gone on. So taking a look, we wanted to share some information from our pilot that we did with 4 institutions. So we had a public 4-year with an N of 497, a public 4-year with an N of 1,041, a public 4-year with an N of 376, and then we also had a private 4-year institution with an N of 172 taking part in this pilot. And this pilot data was conducted between December 2016 and the spring of 2017 at these 4 institutions. And that's what we'd like to share with you as we start out this presentation today. You can see that there's a variety of topics that we addressed in the National Faculty Health Staff Health Assessment. Some are very similar to the National College Health Assessment for students. So when you take a look at topics like general wellness, safety and violence, physical activity, weight and nutrition, alcohol and tobacco use, those are going to be some similar types of topics that you'll see that we assess with students. But some specific things to faculty and staff we wanted to take a look at were issues related to work performance, the work culture, specific demographic characteristics and employment information. So things like, are they part-time, full-time? Are they faculty? Are they staff? Those types of things, so we can compare among the topics with those various demographic and employment information. So some is similar to the National College Health Assessment and some being very different. So let's go ahead and take a look at the first question here from the survey. One of the things that we took a look at was just looking at the general overall health of our faculty and staff and how they would rate it. And as we look at the data, we can see that, you know, a majority of folks are between good and excellent, which is great news. But we also have some folks that are down there towards the bottom and fair and poor. One of the things that we want to do when we take a look at this data is try to move folks across the continuum. So getting folks who consider themselves to be poor or fair, moving them up to fair, good, etc. So trying to get us to move the needle when it comes to how people are viewing their general overall health. Secondly, we had a question that is related to how do they feel about their college university caring about their health and well-being. And again, we see it in a positive direction here, with the majority of folks saying they strongly agree that the college or university cares about their health and well-being. But we also have, you know, about a fourth of folks that fall in that neutral category. So, you know, we want to ask ourselves, why is this happening, and what can we do to change this and move it in more of a positive direction? So those are some of the things that, you know, as we begin to take a look at our own individual data, some questions that we want to be asking ourselves. So for the next question, I'm going to go ahead and turn it over to Holly, and she's going to take us through some more data points.
Thanks, Faith. This is Holly Lovin. Hi, everybody. So the next question that we asked is, do you believe the health and well-being of university staff and faculty impact student success? And so this question and the following question really create a case for those on campus trying to do more in the faculty and staff well-being area. A lot of times it's hard to get funding or resources to do these types of programming or have those resources, but what we can see from this data is that 95% of faculty and staff think that their well-being impacts student success, which is usually the mission of the whole university. So this does play a big role. Same thing with this question here. So how important do you feel it is to model positive health and wellness behaviors to students? As we can see, over 75% think that it's extremely or very important, with 19% saying it's moderately important. So most people are saying it's really important for them to model themselves in living a healthy lifestyle and showing students how to do those things. So again, this also creates a really good case for schools trying to get more resources for faculty and staff well-being. And I also just want to add from what Faith was saying that all of these questions that we're showing you today are from the pilot survey, and from the pilot survey, some questions had to be changed or the wording had to be changed. So all the ones that we're showing you today are still on the survey. We obviously couldn't show you every question, that would have taken a long time, but the ones that we are showing you are on the survey. So moving on here to sleep. How many of the past 7 days did you get enough sleep so that you felt rested when you woke up? So I think when we first look at this, we can kind of see that it's all over the board. Most people saying 5-ish days, 4 to 5-ish days, but really all over the board with this. And so we want to make sure that we're helping people move in the positive continuum, as Faith was saying before. And also we know that sleep impacts so many other health behaviors that if we can give sleep a little bit more attention, it often can impact other health behaviors as well. Okay, my college or university promotes a culture of wellness. Good news here, so most people agree or strongly agree. And so culture of wellness could be a little bit ambiguous or confusing. So we did give people a definition or a reference to go off of when saying to use as a reference point. So we did tell them what we meant by culture of wellness so that everybody was going off of the same definition. So good news here. Again, we have some people in the neutral, but for the most part, we're agreeing or strongly agreeing here. So moving on, we asked what are the main barriers that prevent you from participating in wellness at work programs. So the top 3 are very similar. The top 3 here are time management, having trouble fitting it into their schedule. The schedule of programs don't work for them. And then job responsibilities make it difficult to participate. So all of those 3 are very similar in that they're all they're too busy, right? Time management, there's too much going on. The schedule's not really working. So that's something really we can look at and maybe ask certain groups on campus what times are going to work that maybe we could make it a little bit better for you to come and participate. And then the college or university is concerned about my safety. So again, pretty positive here. Most people agree or strongly agree. And then in the survey tool, we dive into safety a little bit more. We ask if faculty and staff feel safe on their campus in the daytime, on their campus in the nighttime, and then the community surrounding their campus on the daytime and nighttime as well. So that data would be in there as well. So now I'm going to pass it off to Nikki Brower, who's going to continue showing you some more data.
Hi, everyone. Nikki here. Thanks, Holly and Faith. So the next 2 slides that I'm going to speak a little bit about are really addressing workplace incivility. And so for schools using this tool, this could very well be a new
area to be looking at amongst their staff and faculty and graduate assistants. But as we look at these behaviors and how they impact overall wellness and mental health, they're very valuable data to collect. And so this first question is about what the pilot group observes among their coworkers. And so as you can see, as far as the behaviors happening, 46% observe coworkers spreading gossip about others. 34 experience ignoring phone calls or emails. 31 silent treatment. You know, these behaviors make it very difficult to do work. Also, coworkers being ignored or ostracized comes in at 26%. Coworkers taking credit for work or other ideas, 29%. So I think as you look at these, consider how it impacts a person's ability to do work, how they feel in their job, if they feel supported, communicated with, and so forth. And so I'm going to move on. If I can find my click. Thanks. And so now we're looking at, in the past 12 months, what are the pilot groups experiencing themselves as far as incivility? And so number one is the 19% of coworkers are taking credit for their work or their ideas. We also then have the silent treatment at 16.4%. And then ignoring phone calls, almost 16%. And so again, a little bit different, but this is going to be interesting, I think, to watch over time. And as we get a sense of culture and climate around our campuses and have some maybe different conversations at our schools. So I'm going to transition into looking at the time spent sitting. So as we know, as we talk about overall well-being and sitting versus active lifestyles as an indicator of health, these become really important. And so pretty high number, about 472 folks sit about 6.5 hours a day. Got about 400 that sit about 7 hours, and then almost 300 at 5.6. And so as we consider how we might work to support employees or our coworkers or colleagues, perhaps we can do some education programs around adding activity to the day or just small bouts of movement through the day. And perhaps if schools have ergonomics initiatives, they can be looking at variable height workstations or just assigning certain tasks to standing versus sitting, just again to try to break up the consistency of sitting so many hours during the day. And this was really looking at, I believe, in their work environment. So we'll transition. The next two questions are going to be looking at weight. And so as you can see here, about 46% consider themselves to be overweight, and also almost 42% consider to be a healthy weight. I thought the healthy weight category was very, very positive. And so these two numbers are fairly close together in this population. But if we were to look at, let's say we would compare our staff and faculty to student numbers, these numbers would be farther apart in our student population. As we know, they're very vulnerable to these issues. And so now we're going to look at, so what are our colleagues doing to doing anything about their weight? And so, as we might expect, a larger number, 63%, are attempting to lose weight, 22% staying the same weight, and almost 14% not doing anything about their weight. And so this is very interesting information as well, given the correlation to health and well-being also, and perhaps we'll look at these over time too, but there's a lot of movement as far as implementing programs to help support healthy behaviors around if your staff and faculty have weight goals on their mind, that there's some pretty good research out there proving success. So now we're going to start looking at alcohol and tobacco use, and so there's going to be several questions about this. So it's very common to ask these questions in detail of our students, and so if you would compare this to the National College Health Assessment, you would see these same line of questioning. So what I noticed and what we all noticed in this pilot group is that a very high number of them, have never used, tobacco products for the most part. Pretty high numbers, and I think that's very positive. What we'll see about our alcohol use is they're kind of spread out a little bit, right? And so we'll just kind of watch this over time. So now we're going to be looking at alcohol use behaviors over the last 2 weeks. And so very high number, haven't had 5 or more drinks in the last 2 weeks, so 66%. We were also surprised that 17%, almost 18%, do not use alcohol. And then we've got about 7% that have had a episode where they've had 5 or more drinks over a 2-hour period. And then again, we're sort of spread out over time here. Yet the numbers, this is kind of our initial look at this. We'll look at over time, but still these folks, it can negatively impact their lives, their work, vitality, things like that. So it'll be interesting, I think, over time to look at more alcohol use questions, much like we, collect data from our students. And so pretty important line of questioning, I would say. And so in this next question, we're really looking at the impact or the consequences that folks might experience as a result of their drinking. So large number don't report, so it's self-reported that they're having any financial, work, or family issues as a result of the drinking. And then a few, not even quite 1%, say that they are. Again, we'll just kind of see over time how this might play out in our populations. And now I'm going to turn it over to Holly.
Thanks, Nikki. So now we're going to dive into each of our individual campuses and talk about ways that we've used this data, ways that we've done some different programming to try to improve the well-being of our faculty and staff. So I'm going to start, and just a reminder, I am in Idaho at Boise State University. So like a lot of schools, we use an 8-dimension model. I'm sure a lot of you are very familiar with this. So you can see our version of the 8 dimensions. And we use the same model for students that we do for faculty and staff. So we are housed in the same unit, same office, which is kind of uncommon, I would say, to come out of the same place on campus. So we use the same model. And one really popular program is our Bronco Fit Wellness Release Time. And I think that this is so popular because it puts the autonomy back into faculty and staff. So they're able to choose what they do with this time as long as it's improving their well-being and their supervisor signs off on it that they're using it at a time that works for their work schedule. And so they can use this time to do anything in any of the 8 dimensions. So I think traditionally we've seen this be more of a workout release time, and ours is more of holistic well-being. So somebody could use it for something emotional well-being related. So they could go to a counseling appointment. They could do stress management activities. So kind of all across the board here. So this is an ongoing successful thing on our campus. And then since I don't have time to go through everything that we do for faculty and staff, I do want to focus on emotional and social well-being since this is the JED Foundation. So one thing that I've been very cognizant of is that a lot of people are doing online programming, right? It's a good way to reach a lot of people. But what I try to do for every online program is to have in-person components. So for example, we just had a challenge that was all online, but for each week of the challenge, we had meetups all over campus, and people find that very valuable because they're able to have that social connection, that social well-being, meet out, get out and talk to people a little bit about the challenge and just have a little bit of fun. So that's been successful, just to be extra cognizant of that. We do have some mindfulness sessions, and then we also have a restorative yoga class that's very popular once a week that's free for our faculty and staff to use. Another specific emotional well-being program that we did in November was called the 10 Days of Gratitude. And overall, the participation in this was very high, especially compared to the physical well-being challenges we've done. So we've done, fruit and veggie challenges, water challenges. A challenge that focused on emotional well-being actually got double the amount of participants, which is pretty cool to see. And so this was a 10-day program that employees signed up for, and it was basically to show gratitude to those in your office and then across campus. So it spanned all throughout the campus. So very, very positive feedback from that. We will do that again, maybe a different rendition of it, but going forward, there's a need for emotional and social well-being that we can see from the data in this survey. And so when we've done programming that focuses on that, we do see, wow, people really appreciate this. We get really positive feedback. So we're definitely continuing to do that. So I'm going to pass it back to Nikki to talk about her campus.
Hello again. Nikki Brower, and I'm talking about Illinois State University. We are located in Normal, Illinois, a four-year institution focusing on undergraduate education. And one of our, I think, points of pride and what's in our roots is that we are a teaching college. And so that tells you a little bit about the campus. In 1984, our faculty staff wellness initiative was started, and it was a presidential initiative. From that time, we have had a release time policy. We actually, if you look on our website, it's called Wellness Participation Policy, because we use different language for hourly and then exempt employees, but they're all welcome to use this when they can receive approval from their supervisors. We've also had a wellness ambassador program since that time, and this is, I think, one of the key elements to success and connecting us to departments across campus, as you've just heard as well from Holly, and it really is very valuable to, I think, faculty, staff, or employee wellness programs in general. Before 2009, our faculty staff initiative was housed in human resources. At 2009, some changes were happening in the campus. We were building a new student fitness center on the center of campus, and so there was an idea that was, hey, can we form a campus wellness department, kind of bringing together student health promotion and faculty staff wellness from human resources. And so since then, we've been sort of building this unit and really looking at the campus community as a whole and how we might advance health and well-being from that perspective. So our mission is at the top. We're just trying to foster a thriving and engaged campus community that advances wellness at all levels. So much like other campuses, I know Holly just talked about Boise State, we do embrace a wellness dimension model as well. Currently, we are embracing 7 dimensions, and I want to say that we defined these and launched them in 2004, but in the fall, we will be beginning to, we're going to be adding an 8th dimension, which is the financial wellness piece, and then sort of rolling out some initiatives around that and building partnerships across campus. So we're pretty excited about that. But some of the priority programs I would say that we focus on is really about how do we support the vitality of our staff and faculty as best we can with the resources we have, but also based on their needs. And so before the pilot of the National Faculty Staff Health Assessment, we did do a in-house, created by us, a health status survey to kind of give us some feedback and just have those health priorities kind of come to the surface for us at Illinois State. We've had an ergonomics program here for about 24 years, very successful. We have some family-centered programs that we have bowling days with families, both semesters, a day at the Discovery Museum here in our Uptown Normal. And so a lot of folks really enjoy those too. And we're actually going to be expanding that into next year. We had some feedback this year from some folks that had some ideas, and we're just going to try to make that happen with them. Again, kind of supporting that identity of our employee base. We also offer Karoo mindfulness classes. So we offer the basic mindfulness and then Karoo 2.0. So the two of those is an 8-week, there's each 4 sessions. We offer those every semester and including the summer. We also offer on-campus massage. And our massage therapist is here probably 15 hours a week, and folks just sign up online. They pay a nominal fee, so it's basically $15 for 15 minutes, and they can reserve consecutive appointments. We also offer 2 forms of Tai Chi, and those are on Mondays and Wednesdays right after the workday. Actually, in all of those, Karoo mindfulness, massage, Tai Chi, we offer those to faculty and staff, but they're also offered to students. So again, that community perspective of here trying to create the campus culture centered around well-being for all. Our lifestyle enhancement program offers yoga 3 days a week at noon, and then Pilates on Tuesdays and Thursdays at noon, and then again those Tai Chi classes and right after work. But the yoga and Pilates is really just centered for employees, and some grad students will sign up for that as well. We have a graduate assistant position in our office that's a partnership with our academic program. We're a national matching site for dietetic interns. And so Health Promotion and Wellness welcomes a dietetic intern each year, and they work with us for the full year. And they offer one-on-one nutritional analysis to employees, which has been a very well-received and valuable program over the years. We also offer that to students. And then our nursing mother support. So it's been about 5 or 6 years. We approached human resources about writing a policy. We didn't have a policy, and so we just felt that it was important. And so, as a collaboration with human resources, we wrote Nursing Mothers in the Workplace. And then our office helps to connect folks with lactation spaces on campus. We're also working on an initiative to bring them online. And then we bring in a certified lactation specialist every month. And so she presents, she meets with parents one-on-one, they bring their babies in, she does some weights. She also provides some guidance if folks are having issues with latching or what have you. So it's just a really valuable piece. And we offer that to students as well. And then our incentive program, the 7, and as you might guess, it's based around those 7 dimensions. This is an online program, one of the only online programs we do have for our employees, and it's really a logging system, but it's open to the whole campus, and it helps bring about awareness to the 7 dimensions of wellness and sort of observing all of those pieces of us, right, to create our whole. And just lastly, I guess I wanted to say that over the years, what we found to be so important for our employees is that our programs are consistently offered every semester through the summer, year after year, with very few breaks, so that they just can count on them to be there all the time. And so that's just really been so valuable, I think, for our institution. And that's just a piece of wisdom I would share with others who are beginning to start initiatives, is that think about it for the long haul, because our employees stay around. And so how we meet their needs should be a little bit different than how we look at it if we're working with our student base. And so I am going to then turn it off to Faith. Thank you.
All right, thanks, Nikki. Again, Faith DiNardo from Bowling Green State University, and we are here in Ohio, Northwest Ohio. So I wanted to take some time and talk to you about one of our specific programs that we started doing in the fall of 2018 and continue to do this semester as well. But I'm going to share some data that we collected from our pilot of this program campus-wide. And one of the things, as Holly was talking about, some of the barriers to folks participating in health and wellness programs or activities is really time management and scheduling. And we know that based on the data, many of our faculty and staff are not moving a lot throughout the day. And so we wanted to create something that would reduce the barriers to folks, but also focus on something simple. And so we created our 2% program, which is just 30 minutes of exercise, 2% of your day, 30 minutes of exercise a day, and really focusing on the link between physical activity and mental health and emotional well-being. So we created a program called Move for Your Mood. And so that's what I'm going to take some time to share with you today, is about what we found when we did this program, how it worked, and what some of the results were. So as you can see from this slide here, there's a lot of research benefits to exercise, which really affect our mood and emotional and mental well-being. And so being more alert, reducing stress, boosting our mood, sharpening our memory, energizing us, helping to sleep better, which we did see from our data that is an issue for folks. And so all of these things combined really helping to link that physical activity to mental and emotional well-being. And so that's why we wanted to create the Move for Your Mood program. So when we take a look at some of the results here, throughout the fall semester of 2018, we had 850 participants in our programs, with 5 of those being unique individuals. And the Move for Your Mood initiative provided 20 to 30, sometimes longer, minute, low impact and fun physical activity sessions at locations throughout the campus that demonstrate the positive feelings derived from movement. And so again, a barrier to folks is, not wanting to, for example, go to the recreational facility for a program or an event, but really taking the programming to the people. And that's what we focused on with this particular program. So following the interactive and social activities, participants of Move for Your Mood received an educational piece that contained resources and a sample beginning activity plan. We also included a voucher or coupon to participate in more recreation and wellness programming or events throughout the semester. So throughout the semester, we were able to conduct 56 movement sessions. They were all free and open to all. No experience was required. We did provide incentives to participants that also helped to serve as marketing of the program. So we provided the 2% t-shirts to folks. And so these were a hot commodity. In fact, they still are today. People want these shirts and certainly recognize it across campus. And it's really a reminder to folks to think about that 2%. It's not much of your day, just the 30 minutes, and what types of positive effects on your mood that moving has. So this couldn't have been done without some great partnerships across campus. We did a great deal of communication to develop and nurture partnerships. So we were able to For example, go into residence halls, go into our resource centers, go to faculty and staff meetings to conduct our Move for Your Mood sessions. And so there was a lot of partnership that took place and continues to take place this spring semester. We've got a lot of folks that are wanting to partner and wanting to have this programming for their individual partners or departments or programs. We did, as I mentioned, one of the great things about this program is we're taking it out to the people. And so we were able in the fall semester to take this out to 18 campus locations. Our fitness staff went to various locations across campus to really remove that barrier associated with, having to go somewhere else to participate in an event or program. So I just wanted to share some pictures because oftentimes it's nice to see what things look like when you're talking about programs. So this particular picture is of our yoga that we did in one of the resource centers. Again, not a very large space, but enough where folks can get up, get moving, and get that positive impact on their mental health and well-being. Here you see, as I mentioned, we took it to some of our faculty and staff meetings. This is actually our administrative staff council who had just finished participating in a Move for Your Mood session, looking very happy and invigorated in that picture. And then here, one of the things that we do, and as Holly and Nikki indicated, they also do on their campus, is yoga. So we call our program Yoga As You Are. And so folks are able to take some time over, typically this is offered over the lunch hour where they just come as they are, take 20 to 30 minutes out of their day, do a movement session, and get that positive benefit of increased mood and mental and emotional well-being. This is an activity, this is called Yoga Under the Stars. Again, one of our Move for Your Mood sessions, where, again, it's just doing it in a different environment. We actually did this the other evening, 2 nights ago, and had over 100 people participate. So it's something that people are looking for, something different, but again, getting people moving and feeling positive. So we did collect data from our participants, and what we found is that 98% did report the sessions were beneficial. And taking a look at some of the specific findings, so 71% of those participating said that they had improved mood, 52% said they felt more productive after attending a session, 66% said the sessions helped them to relax, 50% sessions helped them feel more energized, 46% sessions helped them enhance their emotional well-being, as I've been mentioning, 43% helping them improve their ability to cope with stress, and then 40% also said that they had increased their physical activity level by participating in these programs. So just sharing a few quotes from the program, just to give you an idea of what folks were saying. It felt great, it gave me an energy boost, it took my mind off of everything. I was having a stressful week, and this helped me relax. Seeing the t-shirts, as I mentioned, as an incentive around campus is a great reminder that physical activity helps with mental health. So just having those reminders of folks wearing the t-shirts can be a reminder like, oh yeah, 2% of my day, the physical activity is definitely linked with improved mental health. I've begun inviting my friends to yoga, and we all agree that it's what we look forward to every week. So that social aspect, encouraging friends and coworkers to go with them to Move for Your Mood sessions was definitely beneficial, as we saw with the program. And so, as we kind of wrap up here, I think between Holly, Nikki, and I, we're hopeful that this was helpful to share some specific practices and programming from our individual institutions. I think sometimes, hearing about it, seeing what people are doing on various campuses can help provide ideas. And also, since we've been able to assess not only from the national faculty and staff health assessment, but also on our individual campuses, seeing that those increases, those positive increases that we'd like to see with our faculty and staff health and wellness. So if you are interested in the National Faculty and Staff Health Assessment for your campus, or you just want some more information after hearing about what we've discussed today, you can certainly visit ACHA.org. You can contact Christine at the American College Health Association directly, and she will certainly answer any assessment questions that you have regarding the survey tool. But I think I speak for all three of us presenting today that we would be more than happy to provide more information to you as well. So with that, I'm going to go ahead and turn it back over to Kyle.
Awesome. Thank you so much, Nikki, Faith, and Holly, for your presentations and sharing the great work that was begun even before the health assessment was administered. And I'm certain that we can dive a little bit into how your survey data has actually influenced a lot of these programs. But before we do that, we're going to go ahead and go through a couple of the questions that you all have been asking. And as a reminder, if you go to your dashboard, there's the question area where you can ask the three presenters about any aspect of the presentation. So go ahead and going back to the National Faculty and Staff Health Assessment itself, we have a question about how if the data can be analyzed by specific demographics, for example, employment classification, faculty administrator, civil service, etc.
Yes, it can be. You can definitely pull out those specific demographics that you want to take a look at and see how they compare with the various topics. So that is something that you can do. And when you do go through the American College Health Association with the National Faculty and Staff Health Assessment, they will provide and give you some analytics of the report, also give you the SPSS file that allows you to do to dive deeper into your data and really look at some of those relationships.
Great. And then when will the assessment be made available to campuses? Or I do believe that it has been.
Yes, right. It is available.
Yes, it is.
So where do we go to find that, and what's the process of implementing the administration on one's campus?
Sure. So you can go to acha.org to kind of get the background information, and then you'll just contact Christine, who her contact info is up here, and she kind of helps get the survey all set up. A lot of times you'll have to go through, depending on your campus, go through IRB to get approval from that and give ACHA your IRB approval letter. So different campuses have different processes, just depending. But contacting Christine would be your first task for that, and to get some more background information or to answer any specific questions to your campus.
Great. And so moving along, we have a question that kind of goes outside of the bounds of four-year institutions and specifically asking about the experience at a community college. And so do you have any thoughts on the three of you on how this might be applied to community colleges? This question works on a commuter campus, and so it's sometimes difficult to engage both employees and students in programming efforts.
This is Holly at Boise State. I can try to take a stab at it. Up until a few years ago, Boise State was very much a commuter school. And just more recently, we've gotten more residential. And so that's a struggle that we still have, is reaching those students who are commuters. But for faculty and staff, I think that this, and fill in if I'm mistaken, Faith and Nikki, but I think that this could be just as valuable to see where the gaps are with your faculty and staff, and see what initiatives might be able to be successful, just so you have a starting point and knowing what initiatives might be most beneficial or work well. So I think it could be valuable too for a community college.
Yeah, I would echo that, Holly. This is Nikki. I mean, we don't know what our colleagues need until we ask them. And so, you know, the assessment would be your first step, perhaps, or perhaps you need a wellness committee that works with this as a project, right? And then as you look at the data that comes back to you, the priorities will kind of rise to the top, and you can kind of begin from there. And you just implement what you can, and you know, you can begin small and then work up. And I mean, I think it would be a wonderful opportunity for a school, and to gauge and connect and engage your colleagues as well.
And I would also add that the survey tool allows institutions to add their own individual questions. And so if there are particular topics or questions that you want to ask your population that may not be addressed within the survey tool, you are certainly able to add those questions to the survey. So that might be helpful too if there's something specific. For example, you want to look at you know, the barriers being a commuter campus or a community college to participating in the various programs or events.
Great. And then before moving on to a couple more questions, I want to address just a couple of technical questions about whether this webinar will be made available for future registrations, and the recordings and the slides. And it will be available. We will have an evergreen link available, I think both through JED and the ACHA websites, where you'll be able to access this a link to share with your colleagues so you can view a recording. And for all the attendees and those who registered for the webinar and weren't able to make it today, we will be sending out a follow-up email that has the recording. And then we will also be able to do something very similar with the slides. So thanks for asking all of that, everyone. We have another question that is asking about how you go about proposing wellness breaks for staff for schools that have never had that for their faculty and staff. How would you go about addressing this with your upper administration?
Is that release time? Is that question?
Yeah, the 60 minutes where you get to go and work on your wellness domain, or the 90 minutes even was one of the other examples.
Right. I guess I would begin with whoever perhaps governs that on campus. And so if that's human resources, if it's president's administration, perhaps it's your shared governance councils. So if you have staff councils or staff senate, perhaps you begin there with discussing the concept of this, and then benchmarking schools that have implemented, and then find out their best practices. And then I would say the things that we've learned over the years of what not to do, because I know I have that story, and I think Holly does as well. And maybe Holly, do you want to jump in here? Aren't you all talking about this?
Yeah, so I mean, I was just going to echo what you said. I think starting with those staff groups, so those governance, so we have faculty senate, we have classified staff, and then professional staff senates as well. So having those groups kind of getting some buy-in. Ours started before I was here, and it was actually from the president that just put it in support. And then from there, our office just kind of took it and owned it and put it back out there.
Great, thank you. We have another question that is asking specifically again about release time, as to whether there are any difficulties managing this with employees who are unionized or are hourly employees.
So I would say here at Illinois, oh, sorry, go ahead. We've had a few issues over the years, but not in like groups as specific as union employees or as hourly employees. The issues have really come up based on department and the practices. And so what I've tried to do in the last 10 years is make myself available to directors of departments and managers and things like that on how they might be able to implement this in their department so that it best meets operational needs, because we use that language in the policy that if it has to meet you know, the organization's need or operational needs of the department. So it's really handled on a department by department basis here. And so, and that way, you know, managers are creating the agreement with their staff, and then our, you know, accountability, building the trust, building the relationship, things like that. My knowledge is that we have very few problems because of that level of autonomy with the department.
This is Holly. I would agree. We've had very few issues in my almost 6 years here, and agree in the nature of the issues. Some, again, department by department, some supervisors are more open to the idea than other supervisors and are willing to let their staff really dive in and pick something that's going to benefit their well-being. And other departments maybe having, you know, bringing us in to have that conversation to help make it more available to more faculty and staff to be able to use. So that's been really the nature of the issues. Again, our, you know, legal team, risk management, has looked at our documents and has helped us use the right language. So that's a step that I would definitely take, is to make sure that that language is correct from their end of things. But issues-wise, I agree. That's what we've experienced.
Great. And with that, we're nearing the top of the hour, and I want to thank you all attending for your questions and for your attentiveness, and for joining us today. And on behalf of the JED Foundation, I would also like to thank Nikki, Faith, and Holly for their time in sharing the results of the pilot study and all of the ways that that has been implemented onto their respective campuses. As a reminder, we will have a recording of this webinar, and you can also reach out to me or to any of the presenters for further questions if you have them. And my email is kyle@jedfoundation.org. And yeah, we are just extremely excited to see how this will be implemented on more campuses, as the whole campus-wide approach of a wellness, emotional well-being, mental health is really important to the operational goals of colleges and universities in protecting and their students, their well-being, their success. And part of that as well is doing that for your faculty and staff in the way that it translates then to the experiences of your students. So thank you again for joining us today, and we hope that you have a great week.
Thank you.